So today I am getting a breast augmentation, and I would say I've been considering it for probably since my mom got her boobs done. So I was like, 10 or 9 or 10, because I knew I wasn't gonna get any ever. So I was like, that's probably my best route. I did a lot of extensive research. I know I looked in the Bay Area first because that's where I'm like located, but I knew that I wanted to go somewhere. One, they specialize in like natural results because that was like a huge thing for me, and Dr. Barrett is like known for his natural results. So I was like, he's probably the perfect choice. And I think he was the only doctor I actually did a consultation with, and I was sold as soon as I did my consultation. I would say definitely go to a doctor that's well versed in their field and knows a lot. During my consultation, I was able to get a lot of information, even if it wasn't necessarily just about specifically what I was getting done, but you know, just like the follow-up process and just going somewhere where you're trusted. Like I have no anxiety going into my surgery, and I'm super comfortable and just more so excited to wake up with my results. So I'd say going somewhere where you definitely trust the doctor and they know what they're talking about.
We're going to put an implant underneath the muscle. We're going to do all through the border of the areola incision. The hardest part of this operation is getting this natural looking pocket placement. We're going to use a silicone implant for her, and we're going to size it on the table in the operating room. We're probably going to be around 250 to 300 cc's. That's our range probably based on her measurements, so that we can get a nice natural looking result that matches the rest of her body. I'm injecting a long-acting pain medication called Exparel. That's this right here. This lasts for 3 days after surgery, so she's not going to have pain. Love this stuff. Make sure your doctor uses it, Exparel. 275 in both sides, looking really good. Make sure your doctor sits you up so you can see how it looks on the table. Very important. Natural breast augmentation recap. We were able to go border of the areola incision. That was the toughest part here. We created a pocket for her. We tried 275, it was too large. We went down to 250, that was a much better size for her. We used a moderate profile. You wanna stay away from the high profile. They tend to look very fake, all right? High profile doesn't mean up here, it means out here, okay? So a lot of people confuse that. If you want up here, it's actually better to go with a more moderate profile implant because it actually widens out, all right? Final result, she's gonna look great. It takes about 6 weeks for them to drop and settle. Time off, 4 or 5 days, she's gonna feel great. We put that long-acting pain medication in there. Questions about this procedure, check out my website, breastbybarrett.com or drdanielbarrett.com. We have virtual consultations, so if you're interested and wanna know what I think, submit a virtual consultation on our website. Also leave your comments, questions, feedback here on my YouTube page, and give me a thumbs up and hit subscribe if you wanna see more cool videos just like this. Thanks for watching. Patience is waiting up. Got our little surprise sprinkle cupcakes. The booby cupcakes. Let's go. They look amazing. I got you some cupcakes. Yes. All right.
That's so sweet.
Thank you. Thank you. Congratulations. Okay, just relax and rest right now, okay? Here we go.
So far I feel great. Literally the very next day I was like perfectly fine. I remember I went to lunch and they were like, oh my god, do you feel great? Your surgery was yesterday. And I was like, yeah, I literally woke up and I had like no pain. It's really just been staying on top of my meds because I think that's what really been helping me, and like the CBD oil and everything. Everything was pretty easy when I got here. It was super seamless just because I had multiple conversations going up to the day of my procedure. So there wasn't anything that was shocking, and there wasn't any questions that I had that day. So I was very calm. I would say definitely just do your research with your doctor. Dr. Barrett was the only doctor that I had seen for a consultation, and then I knew at my consultation this is the doctor that I want to go with because I had done prior research. And then just asking those questions beforehand too, because I feel like the least amount of questions that you have going in, the more comfortable you'll be like day of surgery. I didn't have any jitters or anything like that, which I know a lot of people say is common with surgery. So It's been really smooth. I don't think there was any part of my recovery where it was like hard or I was like not loving my results. Like even straight after surgery, I was like fine. Like I didn't have any bruising or swelling. So I pretty much was already in love with my results like as soon as I hopped off the surgery table. I feel like they started dropping earlier than the 4-month period and like the 3-month mark. So I was already kind of like, oh my God, is this it? And they're like, no, they get even better. So I'm excited to see what it'll be like at 6 months, but I'm in love with the 4-month results already. I did both flying, like today I flew in like this morning, but I've done both flying and driving, and both have been pretty easy. Like even after surgery on like the drive back, I was fine. Like there wasn't any like motion sickness or anything, because I know sometimes nausea is like a symptom after surgery. So I was great with that and everything, and it's been very easy because you know, they give you the option to either do it over Zoom. I just prefer being in person so I can get like everything that I need to know. Like if I have any questions, I feel like I always forget. So I have everyone here to help me.
So here's our patient. She is 4 months out from her breast augmentation, you guys. She was worried about having this look natural because she has such a petite body. We did 250 cc's both sides. She has beautiful cleavage. It's very natural looking. She has a little bit more time for them to kind of drop and settle, but for the most part, she is good to go. Nice teardrop shape, beautiful home run, natural looking breast augmentation.